So there's two things to talk about there. One is the health system, if you like, more broadly, and then specifically how the kingdom has handled COVID. So I think we would all agree that the healthcare system in the kingdom is very, very good.
It is.
It's a private healthcare insurance model for expatriate employees, expatriate workers that are in the kingdom. It's a compulsory insurance that's provided by your employer. And there are various levels, there are various providers, Bupa, AXA, as well as some local companies, MedGolf, Tavernier, to name a few. But it's a compulsory benefit, if you like, that all employees have, is that their company pays for their medical insurance. You have different levels of cover, different networks for hospital treatment, for GPs, for dentistry, for opticians, but it all works very well. Most of this is all now app-based, and accessing the services is generally very straightforward. Certainly my experience anyway in terms of insurance in the kingdom. And then in terms of COVID, well, the kingdom, they went sort of hard and fast, if you like, in terms of locking down, closing the airspace in March last year. They took a very conservative approach to containing the virus, and they seem to have weathered it very well. We've had COVID passport apps for many, many months. We've had free testing, drive-through testing for visitors, expats, Saudis, has all been available, all free of charge for many, many months. And the system for entering the kingdom, if you've been vaccinated, unvaccinated, there is some institutional quarantine if you've not been vaccinated. It's all reasonably clear. It can be sometimes a little confusing because there are so many different categories of people coming in with vaccines that may not be recognized by Saudi, people who've had one dose versus people who've had two doses, people coming from red countries and amber countries. So it's similar to the UK, where we all three of us had to quarantine last week coming into the kingdom, coming into the UK for 5 days, because although we've had Pfizer vaccines, we had them administered in Saudi Arabia, who don't have a reciprocal relationship with the NHS, so our vaccines aren't registered. But it's just understanding that system. If you're there and you get COVID, the Saudis have said that COVID care for visitors, expats, and Saudi citizens will be delivered free of charge. As with the UK, last year, at the peak of the first wave, there was a lot of concern about capacity in ICU beds in particular. And the Saudis added about an extra 50% of capacity to their ICU infrastructure quite quickly. There's lots of parallels between the Saudi healthcare system and the UK in terms of the benefits of being able to move patients, move equipment in a single unified system. Generally, they've weathered it well. As of yesterday, they're down to below 100 cases a day in Saudi Arabia across a population of 35 million people.
Yeah.
So it's pretty low, and the rules are quite strictly enforced in terms of wearing a mask wherever you go. You need to show your app if you want to enter a supermarket, a mall, an office. So they have the rules, they're strictly enforced, and they seem to be having the right effect.
Yeah.